What is athletic training? By Mark Panelo and Liliana Garcia. Athletic training is when athletic trainers and healthcare professionals collaborate with physicians to optimize activity and participation of athletes. Athletic trainers are healthcare professionals who collaborate with physicians to optimize athletes' activity and participation in sport, work, and life.
The 5 practices of athletic training are injury, illness, prevention, and wellness, clinical evaluation and diagnosis, immediate emergency care, treatment and rehabilitation, organizational and professional, and well-being.
The first area of practice is injury, illness, prevention, and wellness. The duties performed in this area are to design and implement conditioning programs for flexibility, strength, and cardiovascular fitness to reduce the risk of injury, design and implement emergency action plans to ensure medical personnel are prepared in an emergency situation, educate patients or clients, coaches, and parents of the importance of the intake of fluid and electrolyte balance in the prevention of heat-related illnesses, assess patients or clients to screen for potential injuries or risk factors that would increase the risk of injury. Some tests would be pre-participation physical exams, musculoskeletal flexibility assessment, muscular strength and endurance assessment, and cardiovascular fitness assessment. The second practice is clinical evaluation and diagnosis. The duties performed in this practice are to perform a comprehensive examination of the athlete with an orthopedic injury or medical condition. That includes an assessment of underlying systemic disease and consideration of its potential contributions to the current disorder, recognizing the role of medications in the management of orthopedic injuries and medical illnesses, create a treatment plan based on findings of initial examination, subsequent examination, and needs of patients to assist in functional recovery, identifying disordered eating and nutritional disorders, and intervene and refer accordingly. The third practice is immediate and emergency care. The duties performed in this practice are to perform an initial assessment of the patient or client to determine his level of consciousness and severity of the condition, implement appropriate emergency injury and illness management strategies following an emergency action plan, communicate the injury or illness and the resulting treatment plan to the athlete and involve a healthcare professional, perform secondary assessment and employ the appropriate management strategies for non-life-threatening injuries or illnesses, including, but not limited to, open and closed wounds, head trauma, environmental illness, seizure, acute asthma attack, thoracic, respiratory, and internal organ injury or illness, acute musculoskeletal injuries, spinal cord and peripheral nerve injuries, diabetic emergency, toxic drug overdose, allergic, thermal, and chemical reaction. The fourth practice is treatment and rehabilitation. The duties performed in this practice are to provide athlete with the knowledge necessary to facilitate recovery, to select, apply, and evaluate the effectiveness of therapeutic interventions using best evidence to guide those decisions. Interventions used by athletic trainers include manual therapy, techniques to restore joint range of motion and muscle extensibility, exercises to improve strength endurance, speed, and power, proprioceptive activities to improve balance, neuromuscular control, and coordination, agility training, exercise to improve cardiorespiratory fitness, sport-specific and/or functional exercises, and modalities, which include thermal agents, electrical stimulation, therapeutic ultrasound, mechanical agents, therapeutic laser, and biofeedback.
The final practice of athletic training is organizational and professional well-being. And the duties performed in this area are use the best evidence and the needs of the athletes to guide their practice, utilize standard coding and reimbursement practices for documentation and billing, ensure compliance with state and federal law and accrediting agencies, policies related to the delivery of the healthcare, such as appropriately use protected information, documentation, and patient education, document and practice appropriate infection controls, equipment safety, environmental hazards, and facility maintenance, and administer programs appropriately per the accrediting agencies for healthcare facilities. This is a brief overview of what athletic training is. Hope you enjoy.